Right, Matt, thanks. It has been a long road, but the COVID-19 pandemic is officially over as of midnight tonight. That is largely an administrative declaration, but the end of the pandemic does mean some people could lose health care coverage as a result. Nicole D'Antonio has more details now from Washington, D.C.
Concern. I have today declared that the coronavirus presents a public health emergency in the United States.
When health officials declared the start of the public health emergency in January of 2020, no one could have imagined that it would last for more than 3 years and that the virus would claim the lives of more than 1 million Americans. But the COVID vaccine and new treatments mean the public health emergency will come to an end at midnight tonight.
Since January 20th, 2021, COVID-19 deaths have declined by 95%.
Some of the changes to our lives that came about as a result of the pandemic will go away now that the emergency is over. For example, the government will no longer buy up COVID tests and give them out free to all Americans. However, vaccines will remain free for practically everyone, at least through 2024. The biggest change is in Medicaid. People enrolled in the program couldn't be eliminated during the pandemic, but those guidelines are now ending, meaning as many as 24 million Americans may lose their coverage and would need to reapply.
Including kids, recently pregnant women, elderly, disabled, who don't realize that they need to reapply for Medicaid. So we have a lot of folks that are in danger of losing their insurance.
Health officials are also warning that just because the emergency is over, it doesn't mean that COVID is no longer a threat.
COVID-19 remains the 7th leading cause of death for Americans, continues to kill about 1,000 Americans a day.
Some changes, such as rules that allow doctors to write prescriptions via telehealth, are staying in place for now. Nicole D'Antonio, CBS News, Washington.